And good morning, everyone, and welcome to AccuDetox Masterclass. And today in the studio with me, well, via streaming through our studio, is Dr. Carel-Piet Van Eeden from the Golding Institute of uh, Personalized Integrative Medicine. Welcome, CP. Can I call you CP?
You may indeed, Warren. Thank you so much for having me. And it's really good to reconnect after several years.
Yes. You did our AccuDetox practitioner course with Dr. Craig Golding. Geez, what is it, 7 or 8 years ago?
About 8 years ago, yes.
Yeah, and we've sort of connected once or twice over the years, but we're all a little bit older, a little bit grayer, a little bit wiser, and
Better.
so let's get straight into it. Tell us, first of all, how did you get involved in personalized integrative medicine?
Okay. So, I think the time we met, I had just come, or I was still working as a legal business analyst at a law firm. And
Yeah.
I then got cancer.
Wow.
I had met Dr. Golding about a year or 6 months prior to the cancer. And it just showed me that moving through the journey of cancer, that there's a big need for a different approach to healing. And that is what Craig practices in his practice as well. But,
Yeah.
it's such a vast scope that I also got involved and then started learning about the integrative approach to medicine and to specifically then cancer and dreaded disease. So one can call it a calling, if you want to say, and
Oh,
it is literally
baptism of
that.
fire.
Baptism of fire, yes. It was, for
Yeah.
me, cancer was the greatest gift that I had ever received because it forced me to look at life and to look at what is really important in my life. And
Okay.
now when I work with people, I try and share with them that message
Mm.
without going too far into woo-woo land. Some people aren't ready for pure spiritual medicine. So
Yeah.
what I do these days is I try and be a bridge and a translator of different modalities and introducing people and sharing with them the options that are out there in the integrative medicine field. Um,
Okay.
and that is a sore need. When you get sick, what do? You
Yes.
go to the doctor,
Yeah.
most people,
Yeah.
and then if it's a dreaded disease, you go to a specialist, and
Hmm.
suddenly you have to trust a complete stranger with your life.
Yeah.
Um, and it's scary and it's overwhelming and it's disempowering. So here at the Golden Institute, we have two legs. We have the practice itself, and that is where we then work with patients or with people to empower them to make better decisions and to make informed decisions um,
Okay.
about the treatment.
Okay. So you spoke about dread disease, but so you specialize in dread disease, or would you advise people on other illnesses as well?
So my passion is dreaded disease, but
Okay.
we look at the whole of a person.
Mm.
So before you get the dreaded disease, the best way to treat it is never to get it. So we look at things like we call it
Prevention.
preventative medicine.
Yeah.
Um, Now, integrative medicine is such a vast field because it says I accept any modality.
Mm.
So it is from purely allopathic medicine down
Hmm.
to prayer and spiritual medicine and everything in between. That is, to me, the definition of integrative medicine. So it's not treating disease. It is that is part of it, but it is living an optimal life. It's not just
Okay.
the absence of disease that we look at. It is how to make the best of this body that we are in.
Hmm.
Yeah,
Live a good quality life while you're alive.
exactly.
That's
And
a excellent approach. Yes.
we try and teach that, and then also, you want to grow old and
Hmm.
die quickly. You don't want a protracted disease state.
Yes. Yes. I hear you.
So,
So
yeah.
one of the challenges we face in alternative medicine is that
Mhm.
there's no real ongoing learning courses. If people want to get CPD points, there aren't courses available. I'm constantly approached by people who are trying to do courses to get CPD points
Mm.
um, in all fields, because every year they have to get CPD points, which means they need to educate themselves. But there's only so many courses out there. So that was one of the goals of AccuDetox Masterclass or AccuDetox Masters, that we could provide this ongoing learning on a monthly
Yeah.
basis, twice a month, with a masterclass lecturer, somebody who's an expert in their field. So tell us a little bit about the course that you offer, and then that will maybe inspire people to join our masterclass and look at ongoing education a little further.
Okay. So that is the other leg of the Golding Institute. Because we practice very specialized forms of medicines, we decided that we can't just see patient after patient, we need to teach as well. So the Golding Institute itself is a training academy where we teach integrative medicine principles to other practitioners. And because I'm not a medical doctor myself, I'm very set on the idea that the knowledge should be freely available for anybody in this field to learn. So,
Yes.
depending on your scope of practice, of course, there are all these legal hurdles. If you are not a medical doctor, you can't prescribe hormones, for example, and we can't
Mm,
get past that. But knowledge on hormones can change the way that you would integrate the knowledge with a patient, for example. So
mm,
we have several courses in the Golding Institute. We have modular courses where you can decide you want to do something like detox therapy and how we can naturally detoxify a patient. We look at things like gastrointestinal health. That's one of the biggest things. Look after your gut. Your
yes.
whole immune system resides in the gut.
Yes.
We treat depression by looking at what people eat first.
Yes.
Um, I am launching an ADHD lab as well, with doing AccuDetox for kids, of course, but also
Wonderful.
looking at the toxin levels. Yeah, I mean, AccuDetox, I have to punt it here, and it's unscripted and it wasn't asked for, but it is a phenomenal therapy that over the past 8 years I still use quite often. Um, and we use it on ourselves. That's almost the go-to therapy for us here if
Yes.
we need healing ourselves and therapy. Um,
That's wonderful.
but in the institute, the course that I shared with you is something that we actually give away for free, and
Wow.
that's an introduction to integrative medicine, and that will be part of the masterclass that we do later with the masterclass here. Um, but it is to just educate people on what is out there, what principles
Yes.
we work on. And
Mm,
that gives you 2 CPD points. We have what we
mm,
call the Integrative Medicine Bootcamp. And the bootcamp itself is a very intense 4-day course. You can do it over however many days you want, of course, now being online. You get a 300-page book that people call the Integrative Medicine Bible, um,
hmm.
which touches on
Wow.
many of the various points of integrative medicine. Um, we look at genetics, we look at cancer, um, alternative treatments to cancer. That's one of the big things that we focus on in the practice as well. We're not against chemo and radiation, but there's 17 other therapies and more that you
Yes.
can. So we introduce people to all of these things. And one of the courses that sells mostly, of course, is IV nutrient therapy. Um,
Okay.
you see all
Yes,
these
that's
bars
becoming
jumping
very
up
popular.
everywhere. It is very
Yes.
popular, but I
Mm,
refuse to sell it to somebody who's not a doctor because of the legalities in South Africa.
yes.
It's still a Schedule 4 medication. So in as
Mm,
much as people can come for the information, there's also, we have to be very cognizant of the fact that you have a scope of practice as a practitioner,
of
and
course.
we need to work within those boundaries. Um,
Most definitely.
we're not seen as real doctors always. Of course,
Mm,
Craig is. He's a specialist physician, so he went through the whole university challenges and the allopathic training.
mm,
But um, there's a lot we can do not having an MBCHB, and that's
mm,
where I focus on, and that's where we work with doctors. And that then
mm,
brings me to another concept that I feel very passionate about is multi-modality practices or
mm.
multidisciplinary practices. One person
Okay.
cannot do everything.
Mm-hmm.
So we work in our practice. I mean, we have two nurses, two doctors, and two other
Yeah.
practitioners here. And each one has their scope of practice and their focus. And
Mm,
we work together for the health of the patient. And that
mm,
is where a lot of the education goes in, that
mm,
even if you cannot practice hormones, for example, but if you are in a medical practice and the medical doctor works on hormones and they discuss it
mm,
with you as an acudetox practitioner, you might see
mm,
the um, some links that they miss. And that's
mm,
where working in groups, I think, is such a phenomenal thing. Knowing stuff without necessarily practicing it is really important for me. And that's the continuous education that we go through. So you have your
mm,
very strong base of your therapy,
mm.
but knowing how it fits into the bigger picture is something that we oftentimes miss. And that's, I think,
Yes.
where your master classes are going to be phenomenal, so that we can
Mm,
start growing in the knowledge of what is possible and not just
mm.
work in isolation.
Wow, you punting this. Thank you. My first interview.
When I'm
Wow.
excited about something, I talk about it, and it's exciting stuff that you are doing.
Thank you. Well, you brought up two things. One, scope of practice and knowing when to refer, working
Yes.
with people, that are experts in their field and knowing what you can do and what you can't do. Um, the other thing is knowledge, knowing what's out there, knowing what everything does and how it works. And I think, AccuDetox practitioners, this is our weakness, is AccuDetox, while it's very powerful and there are great benefits to AccuDetox, and we've seen incredible healings of very many different things. Um, we also, like you said, we need to know that we can't do everything,
Mm.
and we need to take the client's best interests at heart and know when to and who to refer them to.
Yes.
We can always complement the treatment with AccuDetox, but we do need to know when to refer. And knowledge is power, and people die from lack of knowledge.
Exactly.
That
Exactly.
really is the goal of this masterclass, is for us to acquire knowledge. So, I just want to say thank you so much for taking time. I know you're a busy man. I watch you and your Facebook posts, and I respect the way you think as well.
Thank you.
You also you're involved in martial arts. Is that correct?
I am. So Aikido, I used to teach. COVID closed our dojo,
Okay.
unfortunately. But
Ah,
yeah, the body is important, the
yes.
physical expression of the body, and the spirituality. And we haven't
Yes.
spoken about that even. But in
Mm,
medicine, we forget to bring in God or the universe. I get chastised
yes.
for using the word God, but
Yes.
bringing in a high power. Um,
Yes.
and and in that, I practice as a Catholic priest, and we bring that
Wow.
energy in.
Wow. That's
So
fascinating.
yeah, without the judgment of the full Roman Catholic Church, we
Sure.
just believe in spreading love and enveloping people in love while they go through all their journeys. And I
Yeah.
think that's why many of us became practitioners.
Yes. Exactly. If you can't be doing this if you don't love people, it's simple.
Exactly.
But it's so
Yeah,
important. Really, the source of healing is, let's use the word God. If you
yeah,
don't understand that, your healing journey is going to be a lot more challenging. But us as
exactly.
practitioners, our job is not to judge. Our job is to love people, to show empathy and compassion, to meet them where they're at, but to try and help them connect with the God of their understanding.
Exactly. And that's important, the God of their understanding. It's we're not here to
Not yours.
evangelize. And
Exactly.
exactly. And you mentioned something else as you use the word AccuDetox practitioner. And I love the word
Mm,
practitioner because we get stuck in the pitfall of thinking as ourselves as healers.
mm,
We're not healers.
yes, 100%.
And a lot of people, again, it makes them feel uncomfortable when I say that. But in as
Yeah,
much as I help people, I'm not a healer. All I do is
yes,
I present their body with the opportunity to heal. They're
mm,
the healer. Because
yes.
when I think of myself as a healer, I put myself up on a pedestal.
Oh, that's dangerous. Oh,
Yes.
and how the mighty
And
have fallen.
exactly. And that is an unfortunate
Mm,
truth. Again, when it comes to alternative medicine,
mm,
is let me heal you. And I in my mind's eye, I always see a Reiki practitioner running to a car crash with somebody with a broken bone and saying, let me heal the bone. It's
yeah.
possible. And I
Oh,
mean,
yeah.
I believe in miracles, but
Yes,
again, know your place in the bigger picture. It is not less than or more than anything. It is your place. So
yes.
it is just as important as all the rest.
I really like what you said there. You know, we are not the source of healing, but we are involved in the healing process.
Yes,
And as practitioners, we help people connect with their healing,
yes.
you know. And if we, sometimes I've had people call me guru, and I'm like, oh my goodness, please don't call me guru. I'm not your guru,
Exactly.
please. And especially when we see incredible healings,
Yes.
and then people start to almost worship us. Um, the ego is always listening. It's always
Yes.
listening, and it wants to take the credit. And I think,
Yeah.
it's so important to be able to connect with people like you that think that way. So I'm really looking forward to your masterclass. I think let's end the interview there today. But that gives everybody a little foretaste of what's to come with your
Awesome.
masterclass. And we'll schedule it straight after this so we can post it in the links. And
Excellent. Thank you.
thank you. And just have a wonderful day.
And you too. Thank you. It was an honor and a blessing to be part of the group.
Thank you so much. Bye bye now.
Cool. Bye bye.
Okay, folks, that was an amazing, amazing interview. I'm so grateful to have been able to connect with the most amazing people over the last 15 years of my life in my own journey of healing, which I'm still on. I haven't arrived. Um, but, having been at the point of suicide just before my 30th birthday, homeless on the streets of Durban, disconnected from everything, and just the wonderful connections that I've made over the years, it just seems as though it's prepared me and just prepared us for a time like this for Masterclass. I'm so excited about AccuDetox Masterclass. I really hope you'll join us on the journey. Please look at the links below this live broadcast, which will become playable after I end the broadcast. I'm going to be posting all the links to all of our social media pages. like and follow us there, and also a link to the actual AccuDetox Masterclass, where you can get the first 30 days free, and thereafter it's only $9 a month to get minimum two masterclasses per month. I'm going to be aiming for more, but I'm committing to two a month, two masterclasses a month, experts in their field talking about their field of expertise. Jessica, I'm so sorry I missed your message. Are you still in the group? Let me just say hi, Jess. So next time, remember, you can join us in the interview if you want to ask our speaker any questions, and it'll become part of the broadcast. There is a link. Just ask me for a link in the comments, and I'll post a link to the stream, and you can join us live in the studio. For me, I'm out for now. My door's going to burst open any time with the doggy parlor bringing back my dogs. So let me end that before things get embarrassing. Wherever you are, whatever you're doing, do it with love, compassion, empathy. Have an absolute beautiful day. Bye-bye now.